Ready?
Yep.
Okay, I saw some other nursing YouTuber film this video. I don't remember her name, but I think it's Maddie something. I'll try and put it on the screen. She did a video quizzing her boyfriend on nursing terms. So, that is what we're going to do today. Are you going to get quizzed too? So, I have 12 words. I was going to do like she did like 5 easy, 5 medium, and 5 hard definitions. But it didn't really work out for her because they were basically just all hard because her boyfriend, these just aren't words that you guys really know unless you've studied them. So I just picked 12 words. Okay, you ready for your first one?
Yes.
Accessory muscles.
Accessory muscles.
I can use it in a sentence if you want.
It's
Okay.
alright. I would say accessory or the accessory muscles are. I would say they're accessories to essential muscles. Like they're supporting muscles to a bigger one.
What do you think they support?
I don't know. Just the major muscle. Like I can't think of like a muscle group right now. Like let's just say. See, that's the thing. I can't even remember any of the muscles in my legs right now, other than the hamstring. So we're not doing very good right now. Oh, quadriceps.
Okay, I'll start. No.
Okay.
Accessory muscles are around your thoracic cage, and they help you breathe.
Oh.
Yes. Okay. Are you ready for your next one?
Yeah.
PRN.
Uh-oh. Pee right now.
Pee right now. You want me to use it in a sentence?
Yeah.
Okay, if I was a doctor, I would tell the nurse to give this medication PRN. Maybe not right now, but let's just give the medication PRN.
Per request? Something? I don't know.
Close, yeah. I don't know if the letters actually stand for something, but it means as needed.
As needed? Okay.
Yeah, so you just give it whenever your patient
What's the logic, or just
complains.
what's the connection with that? PRN and as
Sometimes
needed?
it's like Latin or I don't know.
Always trying to include Latin into smart things.
Okay, jaundice.
Can you use it in a sentence, please?
My patient's skin was jaundice.
Is that whenever you pick up the skin to see its like reflex or something?
That is skin turgor.
Okay. Jaundice, is it like a
Jaundice.
Color? Is it a color or like
Close.
a color
yes.
of a skin? Is it like red-ish? If it would be like a swollen area? No? Is it normal skin color?
No. Normal is normal.
I guess it means something's going wrong with the skin. It's
it's not normal. It's atypical.
Atypical.
Usually caused from a disease.
Like leprosy?
Leprosy?
Yeah, is it like leprosy? Like not the disease, but
sometimes people who are, I think, suffering from cancer from smoking have this.
Okay, is it like
You usually can see it in the whites of their eyes.
like it's like degrading skin? I don't know. I really don't know. Is it a yellowish tint?
Yes!
Oh, okay.
Ooh.
Yay!
1 for 3, sort of.
Okay. Intubation.
Intubation. Isn't that when you are putting a tube down someone's throat so they can breathe properly or something like that? At least that one.
Yes. Okay. What about intradermal?
Intradermal. Let's see. Dermal means something to do with the skin. So. Oh, is it like it's whenever you not like a vaccine, but any sort of like medication through a needle. It's like under the skin or in the skin. It's an in the skin injection, intradermal.
Yes.
Awesome.
Well, a vaccine,
Well, I'm not. I just meant just like a needle in general.
well, they all have different spots.
I know they have different spots. So what would intradermal be used for?
I don't know. I think Botox is intradermal.
Okay, so like
Vaccines are intramuscular, so they have to go inside of a muscle. Intradermal doesn't go that far. It just
so it's kind of just
stays within the skin.
okay.
I think.
So I guess more cosmetic.
I don't know all types of needles, but I think that's what it means.
Obviously, I know.
Okay, next.
Okay.
Tachycardia.
It has something to do with the heart.
Okay.
But tacky. I don't know. I would say it's tachycardia. So maybe like a heart pump issue. Something to do with one of the chambers, like being sticky, or like.
It's a rate.
Oh, it's a rate.
Problem. So this is not normal.
Too slow of a heart rate? Too fast?
Yes.
Well,
You got there eventually, really.
I know, but tacky, I just don't.
Bradycardia is slow.
Okay. But tacky, whenever I think of tacky, I think of like Laffy Taffy or just a tacky grandma's house or something.
Tacky, in my head, I always said tacky, fast. It's faster. Okay, what about MI?
MI.
Those letters stand for something.
Use it in a sentence. Give it away? Okay.
Well, I don't know. I don't know, was old. He died from an MI.
It's probably so easy, but I'm not going to get it.
Has to do with your heart.
I don't know. A heart attack or something?
Yeah!
How does MI correlate with heart
It's
attack?
the actual name. It's called a myocardial infarction.
Okay.
Heart attack. Boom, bam. What about nocturia?
Nocturia. I would say lack of sleep or sleeping too much or something like that.
Close. It does have to do with sleeping. The first half of that word. So focus on the second half. Nocturia.
It was caused by sleeping?
Nocturia.
Oh. You pee while you sleep.
Yeah, close.
Or you pee
I
in
think
your
it's
sleep?
like you... I don't know. My clinical instructor said it's when patients wake up in the middle of the night having to pee. Okay, next.
That's me.
Hypertensive.
Hypertensive. Is it like specific to anything? Because I would just say hypertensive, like super. Like for me, I would think like flexed muscles or overextended muscles, hyper intensive. They're just being stressed.
Oh, stress? That's maybe a good word, but it doesn't have to do with your muscles.
Is it just a term? A medical term and just for general issues with the body?
I sort of talked about this when I was explaining how a stroke might happen.
Oh, okay, so
How
like too much pressure?
Being hypertensive might lead to a stroke.
To high blood pressure.
Yes, high blood pressure. Boom. What is a bedpan?
People poop and pee in it.
No, that was too easy. Why did I not know that? I've never had one, and I've never seen anybody have one.
That's weird because of your grandma. Maybe, but I guess she had a nurse to
We
help
would
her.
walk her to the bathroom,
Yeah.
maybe. What about an analgesic?
Obviously has something to do with the bum.
No.
It has anal in it. Oh,
You want a sentence?
please.
I can't say a certain word or it'll give it away. My patient was complaining, so the doctor ordered an analgesic.
Is it like a...
Patient was feeling some discomfort.
So is it any sort of discomfort? So it's like a head to toe assessment type of thing where you check what's wrong with them. It's a
good guess.
medication.
Yeah,
Is it like Motrin?
but more broad.
Like Tylenol?
It's not just Motrin or just Tylenol.
It's just
What do those do?
pain reliever.
Pain relievers.
Okay.
Okay, our last word. COPD. What do you think that those letters stand for?
What do you think, Callie? Blank stares. Can you use it in a sentence or not really?
Your patient would be struggling, breathing or coughing a lot.
So it's like congestion.
What do you think those letters stand for? It's a disease.
Closure. Oh, it's a disease.
Mm-hmm. So I gave you one letter. Obviously. Okay.
Let's say. I don't know exactly, but I would say it's called like a closure of like I don't know like any sort of path for airways. I don't know.
Close, but try and guess what
I would say the P stands for path,
path.
like pathway.
Sure. Did you see the answer?
No, unfortunately, I wish I did. O is obstruction. I would say. I don't know. Closure of.
Obstruction.
Okay, so O
Obstructive.
is obstructive.
Mm-hmm.
Coughing. I don't know. Coughing obstruction. Ammonia. Or not ammonia. Pneumonia.
P for pneumonia.
Yeah.
Disease.
Yeah. I don't know. That's all I can. That's what.
Coughing obstructive pneumonia disease.
Is that it? No.
Do you think that's it?
No. That's the best I could do, though.
Chronic obstructive pulmonary disease.
That's right. Pulmonary means lung stuff. Lung stuff.
It's like two different diseases, but you just like that's the word that you call both of them.
You mash it together.
It's a umbrella term for both. I think. Yeah. Anyways, that's it. How do you think you did? Would you pass the NCLEX?
No, definitely not.